Hi everyone, my name is Kendall Mantukani, and today I'll be presenting my applied project titled Fructans versus Gluten in Non-Celiac Gluten Sensitivity in IBS. So this project explores a really important and often misunderstood topic: what actually causes symptoms in people who believe they react to gluten. There's a growing number of people avoiding gluten even without a diagnosis of celiac or wheat allergy, and a lot of that avoidance is based on symptoms that overlap heavily with IBS and FODMAP intolerance. So I also wanted to acknowledge up front that the published research on this topic is surprisingly limited. Some of the stronger studies on this subject were done over 10 or even 15 years ago, simply because very few researchers are studying this area right now. And that lack of updated research is actually one of the biggest reasons I wanted to complete this project, because this topic needs more attention, clarity, and a lot more light shined onto it. I'm doing my internship right now at a gastroenterology office, and we are running into a lot of people with this confusion on a day-to-day basis. So my goal is to walk you through the background, the purpose of my project, my question, definitions relevant to the topic, and then the literature review comparing fructans versus gluten as symptom triggers. And I will end with a summary and the overall implications for practice. Non-celiac gluten sensitivity, or NCGS, describes a condition where individuals experience symptoms after consuming gluten despite having no evidence of celiac disease or a wheat allergy. So these symptoms include a wide range of gastrointestinal complaints like bloating, abdominal pain, constipation, diarrhea, and sometimes nausea. But what makes NCGS confusing is that people also report non-GI symptoms like headaches, fatigue, brain fog, and other general disorders. One of the biggest challenges with NCGS is that there is no biomarker. So we do not have blood work or biopsy findings that confirm this condition, unlike celiac disease. So the diagnosis relies heavily on symptom reporting and elimination diets, which can easily be misleading. So people often feel better removing gluten, but that alone does not tell us whether gluten was the culprit. And even though many people do avoid gluten, that doesn't necessarily mean that gluten was the thing driving their symptoms. This distinction matters because gluten-containing foods don't just contain gluten. They also contain fructans, which are a type of FODMAP, and that is a fermentable carbohydrate known to trigger symptoms in people with IBS. And fructans actually seem to be one of the biggest culprits of this outside of lactose. So when someone stops eating gluten, they automatically remove fructans at the same time. So when they feel better, it becomes unclear if they were reacting to gluten or to fructans that coexist in wheat products. This overlap complicates diagnosis and has real consequences. Many people are told to eliminate gluten unnecessarily, leading to increased costs, a more restrictive diet, decreased fiber, and a lot higher anxiety around food. So understanding whether gluten or fructans are responsible is essential for accurate evidence-based nutrition counseling. Now, I'd like to mention that although public interest in gluten has grown tremendously, the scientific research itself is extremely limited. There are surprisingly few randomized controlled trials that isolate gluten and fructans, and you'd expect a lot more to happen with how forward people are with their gut health and other autoimmune issues that we see almost trending today. So many studies have inconsistent designs or fail to control FODMAP intake, which makes their findings very difficult to interpret. Another major gap is that many intervention periods are very short, sometimes as short as 1 week, which isn't always long enough for symptoms to develop or stabilize. Long-term data is rare, and the definition of NCGS is incredibly inconsistent across studies, leading to mixed populations and conflicting results. And as I did mention earlier, some of the most cited studies in this area are older. And that's not because the findings are outdated, it's because the topic is just so misunderstood and understudied. And that lack of research is exactly why I wanted to focus my project here. So the purpose of this project is to examine whether gluten or fructans cause greater gastrointestinal symptoms in adults with self-reported non-celiac gluten sensitivity and IBS. A key part of the term is self-reported. Many people identify themselves as gluten sensitive without a formal diagnostic testing for celiac disease, wheat allergy, or IBS. This group is enormous in clinical practice and often receives contradictory or overly restrictive nutrition advice. My project aims to clarify which component, gluten or fructans, is actually responsible for the majority of these symptoms or all of the symptoms based on the best available literature. Ultimately, this contributes to better, more accurate nutrition guidance and ideally less anxiety around food with so many restrictions. So my research question uses the PICO format. The population is adults with self-reported NCGS and IBS. The intervention is indigestion of isolated gluten. The comparison is indigestion of isolated fructans, and the outcome is gastrointestinal symptom severity. So essentially this project asks, if we separate gluten from fructans and isolate them, which one actually triggers symptoms? This distinction is important because in real life, gluten exposures are almost always going to occur in the presence of fructans. Here are a few definitions before we move into the literature review. So NCGS refers to gastrointestinal or extraintestinal symptoms after eating gluten without the autoimmune reaction seen in celiac disease. Fructans are fermentable carbohydrates found in wheat, onions, garlic, and other plant foods. These are classified as FODMAPs and can trigger symptoms in individuals with IBS. FODMAPs, more broadly, are short-chained carbohydrates that are poorly absorbed in the small intestine. They are rapidly fermented in the colon, which produces gas and draws water into the gut. An IBS is a functional gastrointestinal disorder characterized by abdominal pain and altered bowel habits, often involving visceral hypersensitivity. IBS overlaps heavily with NCGS symptom-wise, which can contribute to the diagnostic confusion. One of the most influential studies in this area separated gluten from fructans in a randomized crossover trial. The findings were striking. Fructans caused significantly higher IBS symptom scores than gluten or placebo. Bloating increased the most with fructan intake, and only a tiny percentage of participants reacted specifically to gluten. This is a major finding because it suggests that many individuals who believe they are gluten sensitive might actually just be reacting to fructans, not gluten. This aligns closely with what we see in IBS patients following the low FODMAP diets. Further evidence comes from multiple studies on IBS populations. These show that fructose, fructans, and combinations of fermentable carbohydrates consistently produce abdominal pain, gas, bloating, and distension. In some studies, over 70% of participants experienced inadequate symptom control when consuming fructans. Interestingly, healthy controls produced similar amounts of gas to IBS patients, but experienced far fewer symptoms. This supports the concept of visceral hypersensitivity. It's not just the gas production, but it's how the gut interprets it. Although fructans show stronger overall evidence, gluten is not completely off the hook. So several studies actually show that a subset of individuals do react to gluten. In one randomized trial, gluten reintroduction increased abdominal pain, bloating, and tiredness. And in another study involving IBS-D patients, gluten increased bowel movements and intestinal permeability, especially among participants with HLA-DQ2 or DQ8. Another crossover study found higher symptom scores during gluten weeks compared to placebo. So while gluten may not be the trigger for most individuals, some people, particularly those with certain genetic markers, might have some unique sensitivities. But again, the research is so minimal, so it's hard to tell for sure. So going on from that, findings across studies conflict for several reasons. So a major issue is that many early gluten studies, like the last one that I just went over, did not control for FODMAP intake. Participants consuming gluten could also be consuming fructans at the same time, making it impossible to identify the true trigger. The nocebo effect also plays a huge role. Many individuals believe that gluten triggers symptoms, so they report symptoms even when given placebo. GI research consistently shows a very high placebo and nocebo rate. Additionally, some symptoms are too short to capture meaningful symptom patterns. Overall, poor control of variables and strong expectation bias contribute heavily to conflicting findings. There is strong evidence linking symptom improvement to FODMAP restriction rather than gluten removal. Low FODMAP diets improve symptoms in more than 70% of IBS patients. Fructose malabsorption and SIBO are also really common in IBS populations, which further reinforce the FODMAP explanation. Because wheat contains fructans, not just gluten, removing wheat often leads to symptom relief regardless of the gluten content. This means some people may remove gluten and feel better, but the improvement may have been entirely due to fructan reduction and had nothing to do with gluten. This overlap suggests that many people who believe they are gluten sensitive are actually just experiencing a fructan-triggered IBS. So one thing that I found really interesting was how famous sourdough has been getting on social medias and other platforms, because people with non-celiac gluten sensitivity, or just people who have claimed they've never been able to have gluten before and yada yada, claim that they're actually completely fine when they consume sourdough. So sourdough fermentation provides some of the clearest real-world evidence against gluten being the primary trigger. During sourdough fermentation, lactic acid bacteria produce fructanase, which is an enzyme that directly breaks down fructans. Because fructans are the main FODMAP in wheat, this fermentation process significantly lowers the FODMAP content of sourdough bread, sometimes by more than 60%. So actually, sourdough bread is often considered a low FODMAP food, even though it is still made with gluten. So that is the interesting part. Many people who claim that they have gluten sensitivity report that they can tolerate sourdough bread without symptoms. But sourdough still contains gluten, and if gluten were the real trigger, these individuals should react to sourdough just like they would react to any other wheat product. The fact that they don't strongly suggests that their symptoms are driven by fructans, not gluten. And since sourdough is naturally a low FODMAP food due to fructanase activity, its tolerance perfectly aligns with what we see in IBS patients. So this pattern points towards fructan-triggered IBS rather than true gluten sensitivity. Sourdough fermentation also modifies gluten proteins themselves. Lactic acid bacteria partially break down gluten, including gliadin. This can reduce the immunogenic potential of certain peptides, but it does not eliminate gluten, and if someone were being triggered by gluten, even a small trace amount could give them a huge reaction. So the proteins are altered, not removed. So when someone with self-described gluten sensitivity says, I can eat sourdough just fine, that tells us something really important. If gluten were truly the culprit, sourdough should trigger symptoms just like any other wheat breads would. But it doesn't, at least not for many of these individuals. The more consistent explanation is that sourdough is tolerated because it is low FODMAP, not low gluten. So this supports the idea that symptoms attributed to gluten are actually the result of fructan fermentation, gas production, and visceral hypersensitivity. And those, as we know, are the core mechanisms of IBS, and fructans can obviously be a big trigger for anybody with IBS. This area obviously needs significantly more research, and there is no validated biomarker for NCGS. Few studies have successfully isolated gluten from fructans in long-term randomized trials, and most studies are very small, short in duration, or use non-standardized definitions of NCGS. The research is also older than ideal simply because very few teams are actively studying this question, because many people think, well, we found a solution, why go too deeply into it? But given how many people avoid gluten today and how often gluten-free diets are recommended without strong evidence, this is an area that deserves much more scientific attention. The field is wide open for better designed studies. To summarize, the literature shows that fructans are more likely than gluten to provoke gastrointestinal symptoms in individuals who believe they are gluten sensitive. A smaller subset may react to gluten, but this is the exception, not the rule. IBS mechanisms, including fermentation, gas production, and visceral hypersensitivity, likely explain most symptoms. Sourdough fermentation reduces fructans significantly and modifies gluten proteins, yet the gluten remains present. The fact that many gluten-sensitive individuals tolerate sourdough is strong evidence pointing towards fructans, not gluten, being the culprit of these symptoms. Overall, these findings suggest that eliminating wheat may help people with IBS primarily because it removes fructans and it's actually not having much to do with the gluten sensitivity at all. In conclusion, current evidence strongly supports fructans, not gluten, as the main driver of symptoms in most individuals with self-reported non-celiac gluten sensitivity. Understanding the distinction between gluten-driven and fructan-driven symptoms is essential for accuracy with dietary guidance. Recommending gluten-free diets without proper evaluation can lead to unnecessary restriction, increased food costs, and decreased dietary diversity. Future studies that isolate gluten and fructans in longer controlled interventions are urgently needed. My goal in choosing this project was to shine a little bit more light into a topic that has surprisingly limited research despite affecting a huge portion of the population. Thank you so much for listening.